Way.
Yeah, no, hi everybody, and happy to be joining today. So, we'll I think hop into the discussion pretty quickly. So, obviously the focus for us is going to be kind of the intersection of AI and cybersecurity. So, to open up the discussion, I just kind of want to ask, what are some of the unique challenges that all of you are seeing when it comes to the intersection of AI and cybersecurity? And David, I'm going to put you on the spot first.
Well, I was going to disrupt everything, but I'll save that for a little bit later. Healthcare, like it always does, has some unique challenges, particularly I think around AI, and so some of those things include the highly sensitive nature of the data itself. It's highly protected. A lot of industries can run and blow and go with their data because they don't have to worry about the protection issues. We also have within our IT environment typically a whole nother world that we sometimes call IOMT or biomedical devices. They are not as robust and as well built and as modern as most of our information technology. And so you have to play around those areas, and they're also providing data to some of these systems. And then probably the biggest thing is just digital health. When I was a CIO, the healthcare was in the four walls of the hospital or the physician's offices. And today it's everywhere. So data may be coming in, and the data you need to build your large language models may be coming from a drugstore or a monitor that someone's wearing in the house. And so it just becomes more complex to deal with introducing a new technology because of the diversity and spread of the technology in healthcare.
Certainly a lot of challenges. So, Anahi, I'll go to you next.
So I agree with everything that David said, as I usually do. In addition to that, I would add that, people are really excited about this technology and its promise. And we were already seeing the value that it's creating. But because people don't really understand it, they don't understand what guardrails to follow in order to still remain aligned with all of the protections, the governance, the policies that we've put together in order to protect information, protect our networks, and our ability to be resilient. In addition to that, there are cybersecurity threats that are associated with this technology. The threat actors are using it to become more sophisticated. The barriers of entry for these threat actors who can now just go and create, they can go to Warm GPT or some of these other providers that have actually developed AI that can help people quickly develop malware and other threat tools is becoming lower. The barrier is becoming lower and lower because now anybody can go and use these tools to write malware and code. Phishing emails are becoming more sophisticated, and now we're talking about deep fakes and the ability for the AI to actually create incredibly believable videos and voice recordings that can be used to trick individuals. I'll give you an example. I had our innovation center create a video of me speaking to the board about the threats of cybersecurity. They used an image and a video from the internet, asked a model to write a script of a CISO talking to the board, and fed all of that into a model. And for the tune of 13 cents, we're able to create a 2.5 minute video of me talking about the threats. I played that for our board. And after I finished, I told them that I had absolutely nothing to do with creating that video. And they were so confused because for them, it was me in a video talking to them. And so these are the kinds of emergent things that we have to start to think about and sort of tailor now our education and awareness programs to be able to account for these emergent threats.
Some great examples. So, Alyssa, I don't know if you can top an example like that.
No, those are all excellent examples, and I support all of that. I think pivoting from the actual threats that we're seeing, some of the things that we have seen from a trending perspective that are proving to be, I think, more challenging than I think most folks have found with other technologies is in particular kind of to what was already mentioned, kind of the new shiny, right? So it's got AI, so we should probably just do it. And obviously combating the concept of just because it has AI doesn't mean there's actually value. And then kind of to pile on top of that, some of the other things that we're seeing is when we are introducing these solutions and they actually are providing value, is actually tracking the long-term success of them throughout the organization and also ensuring that we don't have scope creep. Because where the model or whatever the implementation was initially may have made sense, I'm sure all of you have seen where, you know, someone else at another department says, well, that's cool, I want to do that too. And then all of a sudden you have a model that is being used for something it wasn't intended for something else that probably could be an issue. And then the other thing that I thought would be important to highlight, similar to the other panelists, is folks aren't really thinking about really looking at the contracts very carefully when people are introducing new AI or new modules into technology they already have. We have seen consistently where the vendors are coming to us and saying, yeah, we have this great new AI tool or new module in whatever system it is, but by the way, your BAA doesn't apply. And of course, if you're not reading that language in there, all of a sudden you potentially have a breach or you potentially have a whole lot of issues. So it's also evaluating the risk levels and the actual contracts that are in place when these tools are coming in.
Yeah, that's a great point. And kind of, it seems like there's a consistent presentation that all three of you made, which are, utilizing tools across the spectrum in your organizations that have AI as a component to it. And then another piece is, the impact of AI in creating, threats or attacks to a system or to an organization. So maybe let's kind of focus on that first vein for, as an initial point, so thinking about, wanting to implement and utilize tools that have AI, so are you establishing policies in your organizations to differentiate between potentially free tools that, I know ChatGPT was that big one when it made its first big splash, that so many people are just going out and utilizing it and not thinking through the implication of that, as opposed to, Alyssa, the point that you just made of contracting to utilize tools and needing to pay attention to the terms that are in there. So maybe I'll go to you first, Alyssa, and just kind of see, how are you handling those two different approaches to use of AI-driven tools?
Yeah, it's a great question. We took kind of a two-toned approach for this, particularly for the freeware related, chat GPTs of the world. We adopted the concept that if a lot of organizations originally from the circles that I was running in were trying to actually block them. And that's like playing a game of whack-a-mole. Because I think a new one spins up every 15 seconds. So trying to actually block all of those from your end users being able to use them is just not attainable. And frankly, also kind of, limiting from an innovation perspective. So what we did is we really hammered home end user education. And we actually took the approach that, many, I don't want to age anybody, but many of you may have taken when browser like search engines came out. Because when search engines first came out, end users are doing wild things. They were just copying and pasting PHI into like Google. Like, why? Who knows? But they were doing that. So we took that similar approach of like, these are very helpful tools. Here are your guardrails. Here's what you should be doing. If you're not doing that or you're doing something rogue, we're going to have a chat, and really started to push that out to the organization as a whole. Obviously, we still have folks that we find out are doing some pretty strange things, and we have conversations with them. But that's really been the big focus on the freeware stuff, because there are benefits to it. The other big thing that we have been pushing is, okay, we have some standardized tools. Please consider those first, because we do have the appropriate agreements in place. So, for example, not that I'm blessing any technology, but Copilot, we have the licenses. Use that. We have a BAA. There's no reason you can't use Copilot over ChatGPT. What are you trying to do? That kind of thing, that kind of discussion with end users. So that's been the approach we've taken, is a lot of education and a lot of, hey, you can use it, just be smart, please.
So David, I think you had wanted to jump in, so I'll turn it to you.
Yeah, I did. I wanted to share some good news with Alyssa and Anahi. I think most of you saw, I want to go back Monday, which isn't even too far from my short-term memory. But we saw an interesting event on the stock market. It was a global event. And at my age, I have to follow the market closely because it may mean I work forever or I get to retire at some point. So I did some research into the events around that, and one of the significant contributors to that was AI investment. Some of the investors who've put literally billions of dollars over the last year or 2 years into AI have started to wake up and realize that the return is not going to be the 6 months or 1 year that they thought they were going to get this out. There is no doubt that AI is going to change healthcare and cybersecurity, probably two of the industries most enabled to benefit from it. But it isn't going to happen overnight. I've never seen a new technology roll out and be deployed and accepted in 5 years even that changed the world. This is going to happen, but when the investors start thinking about it and getting smart, this is an opportunity that we need to seize in the providers and say, yeah, we want to do this, but we want to do it right. Let's choose small proofs of concept. Let's pick things we can manage and control, and let's kind of go from there. And it all comes back at the end of the day to answer your question. And I'm an old governance guy. You have to build the governance and controls around it. And one thing that AI might allow us to do in healthcare, which we've not done a good job, is build data governance from a combined perspective. It isn't just the owners of the data, the clinicians and the finance people, but it has to include security. It has to include the clinicians. It has to include researchers, and they all need to have input into that. And we need to understand from a security perspective what they need, because if we don't know what they need, we're going to wind up protecting the wrong thing. So we got a big dose of reality Monday. Let's capitalize on that and build some models and ways we can contain and use this that will actually move things forward.
David, that's where I was going in terms of one of the first things we did, recognizing that the desire for adoption was immediate, was stand up a governance committee with a lot of the stakeholders that you mentioned to start to develop the policies, the education and awareness, the controls, the mechanisms, the guidance. We had originally blocked the Gen AI category on our web filtering tools, but recognizing that everybody's got a cell phone, and if they can't get to it from the computer, they're going to use their personal devices. And so what we were doing was losing visibility. And so the mechanism that we now have in place is we've opened it up, but we do, as people are going to any sites that are categorized as Gen AI, we force them to review the policy and acknowledge that they understand the policy. We give them unfettered access to the degree that they're not putting in sensitive data. And we use our data loss prevention technologies to block any sensitive data that is identified as being, as an attempt to be submitted. And that seems to be working relatively well, and, allowing people to use the things that they want to use while still maintaining the protection. I think one other challenge that I want to call out, because it stemmed from a conversation I was having with an insurance broker, and I hadn't thought about this until he brought it up, which is the insurance industry is obviously paying a lot of attention. The cyber liability insurance industry is paying a lot of attention in the space The one area where they're specifically focused, it's on resiliency and over-reliance of these technologies, and really starting to build the trend around as we become more and more reliant on the technologies to deliver patient care, what happens when those technologies are not available? Will we lose the muscle matter that we currently employ to make care delivery decisions? And so it really resonated with me because I hadn't thought, I spent a lot of time thinking about organizational resiliency should we suffer that ransomware attack and our EMR is not available or our medical devices are not available. And I worry about those things because our caregivers are so used to the technology, they've almost forgotten how to chart on paper, how to deliver medications, how to draw blood without technology. But the reality of it is that as we start to become more ingrained in the Gen AI and our clinicians become more dependent on Gen AI, when that's not available, that's the other thing that we're now going to have to start worrying about. And so I'm so thrilled that I had that conversation with him, because now I want to share it with the rest of the world for those of us that weren't thinking in terms of building resiliency into the adoption, to start thinking about it. We have a great opportunity to sort of build the foundation now so that we're not caught off guard when we're so reliant with the technology and it's not there for us to use.
Yeah, that's a great point, because I think the outage that the attack on Change Healthcare caused kind of showed a lot of that impact as well, where obviously you couldn't, there was a lot of claim submission that couldn't happen, but the ripple effect, and then in combination with the CrowdStrike event when Microsoft went down, it was kind of both of those events showed that a lot of folks have gotten so used to and reliant on technology to accomplish so many tasks that there was a lot of confusion as to what to do, with when that's not available. And Anahi, to your point about paper, not knowing how to do paper charts, I kind of wonder, as we keep having newer clinicians enter the workforce, have they even been given the opportunity to do paper charts? Because to some degree, it might be viewed as archaic and something that's not necessary within the education. But I'm going to kind of pivot slightly. And I think all three of you were talking quite a bit about the free tools that are out there, but also at the same time recognizing that you want to have officially sanctioned tools. So as you're thinking through potentially partnering or working with a vendor that has Gen AI built into their product, kind of what are some of the protective measures or other features that you're looking for, and you're going to vet maybe through a security questionnaire or seek to have built into the contract for use of that tool? So Anahi, I'm going to turn it right back to you, since you haven't been able to lead off yet.
So certainly, like any other technology, we're going to put them through our risk assessment processes and look at how they have built their controls in order to manage some of the potential risks that now come with the Gen AI technology, such as how they're building their LLMs, how they are protecting from hallucinations, how they are putting guardrails in place to account for potential bias. So a lot of the things that I think we're all concerned and monitoring to ensure that they're not introduced into our environment, and that'll become part of our risk assessment process. And it already is. We're already catching things like, literally, I think an hour ago, I had legal come to me because one of our research institutions wants to share PHI to see if they can improve the AI models on some cardiac device. It's like timeout. We wouldn't do that with a regular vendor. Why would we do that with Gen AI tool? But in addition to that, we are also looking at technologies that can monitor the use of Gen AI on our network, to also account for those, the functionality in existing solutions that will all of a sudden appear, that didn't need to go through a new contract. We're also, to Alyssa's point, looking at what contractual provisions do we now need to put in place to ensure that we are governing and managing how AI gets introduced into our environment. We don't want vendors to just update functionality into a technology without our knowledge that now utilizes Gen AI without our ability to put it sort of through our processes. So there's a lot of work to be done, but we're already thinking about what are all of those things that we need to do from a security perspective and legal to ensure that we continue to align with the emergent adoption of this technology and the potential threats to our organization.
So David, you want to jump in next?
Yeah, just real quickly, and Ani touched on it a little bit, but Gen AI is the big scary one for me. We've been using AI for many years in kind of standard tools, particularly in cybersecurity. Machine language is used a lot in cybersecurity tools, and those are contained. It's the Gen AI you need to look at, and back to a question we heard in the panel right before this one. Terry Coots said, what problem are you solving for? And so it depends on what AI we're putting in and what it's doing. So anything that's touching patient data or looking at patient data, if it's Gen AI, you have a whole bunch of issues that you need to look at. Many of the security tools are very efficient. They do monitoring, they do watching, they're using basic AI and machine learning basics. Those are to be encouraged. But the biggest issue, and I think you touched on it a little bit, Matt, and Alyssa certainly has, is we don't know. And I go back to MetaTracker, and I threw Google out of my hospital in the early 2000s because they wouldn't sign a BAA and they wouldn't tell us what they were doing with the data. Well, nowadays, we don't even know where our third party connects, and we're finding we're responsible not only for the third party, but the fourth and the fifth and the nth party. So it really comes down to the third party risk, and just ask CrowdStrike, what could possibly go wrong? And they did nothing wrong, but the bad thing is always going to happen. But when you're looking at patient information, when you're looking at Gen AI, I think we need to go that extra mile and make sure those things are there. And to Ani's point, it isn't about security anymore. Security has to be there, but it really is about resilience. Can you keep operating when that bad thing happens? And that's the story. We've become so dependent on the technology that when the technology fails us, which it always will, we don't know how to deal with it. And that needs to be built into any agreement when we're putting in any new system, but new technologies in particular, because we've not had to deal with those issues.
Absolutely. And the other element that I would also toss out there is the other hat that I have the honor and privilege of wearing for my organization is e-discovery. And I always like to remind folks, particularly from a AI perspective, this is obviously the new frontier. And I always like to force them to put on a judge's hat or a jury's hat, particularly around medical malpractice or any other case. If we can't explain this technology and it did something, or someone is claiming harm and we can't really explain how it did the thing that it was supposed to be doing for our organization, we're in a lot of trouble. And so I always have that conversation with the business or the end user who is introducing this new thing that they would like to do that's the new shiny, right? Is okay, does it actually solve the problem that you're trying to solve? And also we have to make sure that it's explainable, because if we get into hot water, we have to be able to explain it. If we can't, we're going to have a lot of settlements that no one wants to deal with.
And so I kind of have maybe a little bit of a controversial question to ask based off of, kind of specifically, Alyssa and Ani, what you're talking about from the contracting process. Having personally come out of the vendor world recently and being in forums where there are a lot of startups involved, there's a lot of, I would say, gentle concern raised that the contracting process can be overly long and convoluted when trying to work with the bigger health systems. at the same time, I fully appreciate everything both of you were saying, that there are a lot of protections and there's a lot of unknown from your side that you're trying to protect against. So I guess, just would wonder what, how both of you might respond to that, and kind of if you have any suggestions of how can you go about working to make that the contracting process work more smoothly and efficiently for both sides, because I suspect at times you feel like you're not getting answers to the questions that you're actually asking.
I'll be happy to start that one. For many years now, I've talked about how this country produces the worst software in the world. And it is a very simple explanation for that. And it's an initiative that both actually Ani and I are involved in, and that is developing technical standards for hardware and software, particularly in the healthcare space. If you don't want to play with those standards and the rules for developing software and how you test software and hardware and how you move data around, then you can make a decision as a business. But if you want to play in the healthcare space, the risks are higher than any other sector, then you need to follow some standards. The medical device makers do that globally with ISO standards, but we need to develop software standards, even implementation standards and testing standards. We don't require in this country any vendor to test the security of their software before they dump it on the market. And then we wonder why we keep having these outages and shutdowns. Doing the same thing over and over again is the definition of insanity. If you want to play in this space, you have to follow some of the rules. And I'm not talking about legislation here. I'm talking about vendors getting together and say, we've created enough havoc out there. Let's try to eliminate some of that havoc and bring some sense and common sense to how we do this and how vendors can trust us when they buy from us. It's a big initiative. It isn't going to happen in a year, but we have to start somewhere.
Yeah, and I think, David, you're once again spot on. But I would also encourage the vendors to think about, to anticipate what the challenges are that they're experiencing and get in front of it by being prepared to respond. The Healthcare Sector Coordinating Council developed model contract language that was a partnership between the public, the private sector. It included technologists, vendors, that all had that same challenge, Matt, of we're being asked to negotiate thousands of different clauses depending on the organization. Can we all come up with and agree on standard contract language that can be utilized and works for all of us, and it's reasonable? I would encourage any vendor to take a look at that document, and if not fully adopted, at least adopt components of it that are reasonable for the size and product, as a way to lessen the friction. I would also say to the vendors, if you want to do business with us, then you're going to have to acknowledge that we are in a high-risk industry, and we need to ensure that the protections are in place and that they are contractually required so that our partners don't deviate from the standards that we've mutually agreed to from a technology and a cybersecurity perspective. It is a partnership, but I think that the vendors need to recognize that for as much as you're challenged with these kinds of negotiations, we too have thousands of vendors that we're negotiating with. So the pain is equal on both sides.
I 100% agree. And I think to also chime in on that too, also understanding and being vendors should, it always baffles me when we go into these negotiations and it seems like we're the first time they've ever heard of HIPAA, or the first time that they've ever really discussed actual, like the regulations that around healthcare, and the understanding that, most of this is not by our choice. We have these contractual provisions in place because we have to. And in many cases, they also don't understand that some of these are trickle down provisions from payers or from, like whatever the scenario might be. And so, I think just being more in the loop on the requirements of the healthcare field in general will go a long way, with us not having to educate every single time we have a contractual negotiation of this is why it's in here. We're not trying to be difficult. We have to have this.
Yeah, no, and that's a great point. And it's, certainly a conversation I've had multiple times, as I've worked with different companies, because it's, I think as you're implying, a lot of the companies or the folks behind the companies are new to the healthcare field. And, unfortunately, they don't understand that they stepped into an industry that is subject to an enormous number of regulations and arguably at times contradictory regulations, because different pieces might not fully understand what the other side of the regulation is doing. But kind of leaving all that aside, I kind of want to go back to that other avenue that all of you are raising up front, which is the intersection of AI with the creation of cyber threats, and then the integration of AI into maybe potentially acting as a shield against those kind of new and emerging threats. And Anahi, I think you were the one who gave that perfect example of how AI could be utilized to create a threat or create an attack. So wondering, beyond that, kind of what are you seeing in the field in terms of how AI is driving, new iterations on attacks against organizations?
It's primarily around the sophistication of existing threat vectors. So the development of really believable phishing emails, because you can use the AI to generate really robust, credible emails. It's utilizing Gen AI to move faster and at a larger scale than the traditional, potentially manual efforts that were being used. It's the ability for those threat actors that are not very sophisticated or even technical to be able to pay a small fee and leverage the technologies. It's using things like Warm GPT to create malware, even for people that aren't programmers or have no idea how to create software or codes. That's what we're seeing for the most part now. But we also recognize that the sophistication of voice and video, it's coming. I'll give you another example. I am a member of Health ISAC, an information sharing organization, where we share threat intelligence, and a member organization actually shared with Health ISAC, who shared with all of its members, that their CFO had received a Teams invite for a video call from their CEO. He had joined that call and begun a conversation over video with their CEO about a potential merger and the need for a transaction. CEO subsequently went on voice only, which is common in a lot of our calls, so he thought nothing of it. But then as the conversation developed, he realized my CEO would never ask me to wire this kind of a transaction for an M&A that had no contract or paperwork in place. So he hung up, called the CEO, and the CEO had no idea what he was talking about. And this is something that happened to a healthcare organization in the United States. So it's possible. It will continue to happen. And those are the kinds of things that we're preparing for as we begin to do different education and awareness, because ultimately it's going to be, they're probably not going to be able to overcome all the technology controls that we have in place. And as the threat actors use the Gen AI, our products will also be able to leverage Gen AI to protect our organization. So I think that may be a wash. It still comes back to the people that I think are going to remain the targets.
And
I guess, Alyssa, I'll turn. Oh, sorry. Yeah, go ahead, David.
I was just going to say, Alyssa and Ani are sitting in the provider space, so I kind of look at it from the reverse angle. It's coming, and here are some of the ways you can protect. We know it's going to bring new threats with it, but AI, particularly Gen AI, really needs to be audited. It does think for itself a little bit. So you need to keep up with it when it comes out. It needs to be checked on a regular basis to make sure it hadn't figured out how to do things you don't want it to do, or found ways to escape the cage you've put it in. The biggest thing, and we've talked about governance and data governance, but we really need with AI, particularly the Gen AI, to be very careful with the information that we share, particularly if we're building large language models that include patient information, how it goes out, how it's used, how and where it's stored, and that kind of thing. Data security is going to be even more critical because data poisoning is one of the techniques that you can use to disrupt your AI models and how data is then used. And so the data security and protections are going to have to be enhanced. You will have to optimize your software. We know healthcare is not always number one in doing patches and updates. This is a tool that when you get a fix, you probably don't want to wait 30 days, 45 days. If there's a security fix to an LLM, it probably, or an AI tool, it probably needs to happen very quickly. We need to train our security people on this new adversary. And it's AI. It isn't just the bad guys anymore. It's the tool itself can be turned against you. And Alyssa kind of talked to it, but we've not done a good job historically. We're rolling out a new technology. We need to train our staffs, our people, about what the risks and the issues are. They're the users. They're not only, we like to say they're the last line of defense, but frankly, they're the first and last line of defense. If they don't know what can happen to them, they're going to let it happen. And it's not intentional, it's not malicious, but it will happen. And one thing Ani talked on is we've got to build in the IR, the incident response around an AI issue up front. The time to figure out how you respond to an AI incident is not when you're in the middle of it. It's after you've rehearsed it, after you've written the procedures, tested it, and been through it. So these are some of the things. It's coming. Anyone who tries to stop it, it's the whack-a-mole game. And it brings great advancement to healthcare and, I believe, to cybersecurity. But we've got to be ready for it. And like the investors Monday, they realize they're not ready. The markets are coming back. It's going to take a little longer, and we need to make sure we take the time to do this correctly.
So, Alyssa, do you have any thoughts to share?
Honestly, I mean, they have covered most of it. I think the only other thing that I would toss in there is we are seeing too that because it is so readily available, that social engineering has also become exponentially easier. I mean, but prior to that, it was already at your fingertips, being able to look up someone's LinkedIn or where they lived, or start to compile data elements of the actual person to start doing whatever malicious thing you wanted to do. But with generative AI, social engineering has just become exponentially easier. And like Ani mentioned, we can no longer train our end users to look for spelling errors in phishing emails, or for the general stuff that we normally were training with security awareness. It's now we have to have all of our end users be exponentially more sophisticated in what they're looking for, because that's who's out there trying to attack us.
Yeah, no, kind of that training and that education and awareness piece has always been so important when it comes to security and maintaining privacy. And I think that also touches on what you mentioned on here around the threat intelligence sharing, because if an organization doesn't kind of let others know what unique attack they suffered, or kind of a unique approach that they had to face, it's hard for others not to fall victim to it. But as we're already kind of getting close to the end of our time, I'm kind of going to wrap it up by allowing all of you to have kind of a final parting thought. And I'd like to frame it around, what do each of you see both as the greatest benefit and the greatest current risk to the integration of AI into healthcare from a security perspective? So I'm just going to arbitrarily look left across my screen. So Alyssa, that means you're up first.
All right. So I think to kind of summarize this as a whole, I try very hard not to be like the doom and gloom security person. So I think that it's critical to call out that AI, while not new, like David mentioned, there are a whole bunch of new, really great things that are happening in that space. And one of the things that we have been trying to do from a cyber perspective is kind of lead the charge in responsible implementation of AI so that you can actually point to that and say, like, hey, look what we did for GRC automation with X, or whatever that might look like, so that we can actually point our end users to say, like, this is how you can do it and do it well. Not to say that we're perfect by any means, but I think really truly the biggest risk is really the like I mentioned earlier, the new shiny. I think people are just, it's so exciting and everyone wants to get on that train, and no one is slowing down to think, okay, but do we need this? What is it for, and what does it do? And having actual knowledge of the technology prior to implementation. I think there needs to be a whole lot more of an understanding from end users and implementers of whatever the technology is, so that we're not just flying blind and trying to implement things because they're cool. That's really my summary.
No, some great points. David, you're up next.
Yeah, what I learned many years ago, a quarter of a century or so ago, when I put in my first EMR, was that there is too much for a physician or a clinician to know. And that's why we needed these systems. As a security official, I can tell you there's way too much data coming at the CISO today. Just a small network has millions of data points hitting it on a daily basis. No human being can keep up with that. We've got to have AI to move into the digital health realm. The biggest risk, I think, is not doing it right. We're going to have it, but we can put it in quick. That's speed to market is the message everywhere, whether you're a cybersecurity vendor or a hospital CEO, time to market. But the problem is, if you don't do it right, you spend the next 7 years cleaning up the mess you made, and it costs way more than doing it right. So it's coming. We need to do it. The message and the lesson is, let's do it right. Let's involve everyone and make sure we cover all the bases.
No, thank you. And Anahi, you get that cleanup today.
Yeah, so there's a ton of clinical and business value in utilizing the tools responsibly. What I would encourage organizations is to walk towards it, not run towards it, but not run away from it, because it's here to stay. And so implementing really sound, transparent governance processes, I think, are really important, as well as a really effective communication plan, so that the right messaging and education permeates the organization. And from there, really, our approach is to start with a co-pilot model. And I don't mean co-pilot in the branding, but we're not just going to have Gen AI replace a thing. We're going to have humans that are going to check the quality, the efficacy, the outcomes of the technology, to ensure that we're being really responsible and continuing to deliver sound clinical care. And then on the cybersecurity side, really staying abreast with the emergent threats and how the technology is being utilized, and ensuring that the security programs are informed by those threat vectors and prioritized. Gen AI may become a higher priority than phishing exercises if we identified this to be the bigger threat. But it goes back to doing the things that we've been doing all along, dialoguing with business and clinicians, and having sound governance processes in place, regardless of whether it's Gen AI or X other technology.
Yeah, no, thank you. Thank you to all three of you for sharing all your thoughts. And Carol, I'll turn it back over to you.
Yes, thank you all. That was terrific. And thank you so much for bringing it